Good morning, everyone. I want to say welcome to Terre Haute and to the campus of the Wabash Valley's leading medical center, Union Hospital, and of course to the Lansbaum Center for Health Education. My name is Mike King. I'm with the Public Relations and Marketing Department here at Union Hospital, and it's a pleasure to welcome you all to Terre Haute. Our director, Kim Perkins, is here in the tan jacket. She will be at the top of the stairs at the end of the press conference with a variety of press releases that are available. If you didn't get one when you came in, certainly make sure that you grab one on the way out. We are here today to publicly launch a Department of Labor education and outreach effort for healthcare industry employers who will voluntarily take part in order to ensure safe and healthy workplaces for Hoosier employees. The nature of the problem, the solution, and the importance of safety of employees in the healthcare setting will all be discussed by our three guest speakers that are with us this morning. Following the presentation, all three will be available for your questions. We're going to begin this morning with Indiana Department of Labor Commissioner Sean Keefer. Mr. Keefer was appointed to his post January the 14th by Governor Pence. Mr. Keefer previously served as Deputy Commissioner of the Indiana Department of Labor under Governor Mitch Daniels. Additionally, he served as Chief of Staff in the Indiana State Department of Health. He was also Director of Global Health and Science Policy for the American College of Sports Medicine. Ladies and gentlemen, Indiana Department of Labor Commissioner Sean Keefer.
Thank you, and thank everyone for coming today, and I want to thank Union Hospital especially for this great initiative as we try to increase safety in the healthcare workplace. The Indiana Department of Labor's mission is to advance the safety, health, and prosperity of Hoosiers in the workplace. And one of the industries that has really become a lot more robust and is growing is the healthcare industry. More than 300,000 Hoosiers are employed in healthcare, and one of the things that the Department of Labor have noticed over the last couple of years is that it's increased the second highest non-fatal work-related injury and illness area in the state. And so only agriculture surpasses that. So one of the things that we looked at is how do we, as the state of Indiana, the Department of Labor, partner with other folks to decrease this statistic. We're at 6.3 of every 100 healthcare workers that has a work-related injury or illness. And so if you imagine, hospitals have a 7.2 for every 100 worker injury and illness rate, and nursing and residential care facilities almost have a 10% or 9.5 per 100 worker injury and illness rate. And so we have a lot of work to do. And so one of the things that we'd like to do is look at other industries that have historically had high injury and illness rates and have been able to decrease that. And one of the areas that we can look at is, for example, manufacturing. Currently, they have a 5.2 per 100 worker injury and illness rate, but they historically were high. And a lot of folks in the industry got together and said, hey, you know, how do we lower this? And they put their heads together and have done exactly that. To give some more perspective, healthcare workers are 38% more likely than construction workers to become injured, and 17% more likely than manufacturing workers. So the question really is what kind of hazards to healthcare workers, what do they face? So the main things are slip, trips, and falls. That's probably the vast majority of the injuries that occur at the workplace. But also, as you can imagine, lifting and lowering patients, long and irregular hours that can lead to illness, acts of violence, and so a lot between, especially residential or long-term care with the patient and the caregiver, and exposure to bloodborne pathogens. So the rate of injury and illness must and will be addressed today. Today we begin the process with the campaign to address accidents and illnesses in the healthcare workplace. I'll outline the specifics of our initiatives in a minute, but first I'd like to introduce one of our sister agencies, the head of that, Dr. Van Ness, and he has a very unique perspective having administered a hospital, and I've been able to work a little bit with him in the transition, and like to have Dr. Van Ness come up and talk a little bit about the Department of Health's perspective and his professional experience. Thank you.
Thank you, Sean. Well, good morning. It's great to be back in Terre Haute again. We're talking to a couple of fellow physicians. Having been president of the Indiana State Medical Association in '93-'94, I had a chance to spend some great days in Terre Haute with, I think, a tremendous physician, Dr. Paul Siebenmorgen, and learned a lot from him. And so you have some great people here in Terre Haute. Healthcare workers are extremely important to our state. As you just heard, healthcare is one of our leading employers in the state. So healthcare workers are certainly critical, and they deserve a safe and healthy environment. When doctors and nurses are healthy and at work, other Hoosiers have access to some of the best medical professionals in the country. Healthcare worker safety obviously is a serious issue that requires kind of a multilateral approach to reduce illness and injury to workers. That's why I am pleased to be here today representing the State Health Department in support of the Department of Labor's initiative for healthcare safety of the workers and my good friend and Commissioner Kiefer. The State Health Department regularly works with hospitals, nursing homes, and other providers to encourage and assist healthcare quality improvement initiatives. Through our licensing and healthcare quality improvement activities, we continue to encourage facilities to focus on worker safety and use the Department of Labor's safety initiative as a tool to help them reach their goals. For example, hospitals and nursing homes are required to meet quality assurance and performance improvement standards set by the federal government. Part of this improving quality of care means that these facilities must submit a quality improvement plan. The Indiana Healthcare Worker Safety Initiative that's being introduced today will be a great resource to the facilities as they plan for overall quality improvement and the improvement of patient care. Patient safety and healthcare worker safety are closely aligned. The issues that apply to a patient also apply to workers. That would be lifting injuries, needle stick injuries, and so forth. So when patients are safe, workers are safe, in our opinion. Now, this past year, State Department of Health had 2 leadership conferences, each with a focus on safety, patient safety. When you improve the safety of your patients, you again improve the safety of your workers. Having been a hospital CEO for 15 years, I did learn about safety in the workplace, and we noticed at our facility, we had a 2.79% injury rate per 100 adjusted patient days. That was in 2010. We said that's too high. We formulated a plan. It did work. 2011, it dropped from 2.79 to 0.97%, and last year was 1.15. So I personally am a believer in improving workplace safety for healthcare workers, and I hope that's a good example of what we did. In closing, Governor Pence wants to attract jobs to the state of Indiana, and healthcare jobs are certainly critical to that. Having also served 15 years on a local Corporation for Economic Development, I did have a chance to see what businesses would ask when they came into a community, and one of the things they asked was the health of the workforce. So I've heard from them firsthand how critical a healthy workforce is to a new business coming in. So in order to ensure that we have a healthy workforce, we need an environment that does support a healthy workforce. We believe the Indiana Healthcare Worker Safety Initiative will help do that, and we'll continue to promote it as a resource to the facilities that we serve in the state of Indiana. Thank you. I'll turn it back over to Sean.
Thank you, Dr. Van Ness. So it's clear we need to address this issue, and so, the way in which we're looking to do that with the initiative is a 3-prong approach, and that is information, education and training, and consultation assistance. And so first, we'll provide information about safe practices and procedures to hospitals and other healthcare facilities around the state on a regular basis. And so one of the key things in regard to employees understanding is having signage and other things within the hospital or healthcare system to better understand what exactly you need to do. And so whether that's a new employee that comes into the system or an employee who maybe changes the type of job duties that they do, to make sure that they have the latest information and to continually be speaking with the supervisor about ways to improve their safety. But also just in regard to whether that's blogs or publications or working with associations to get the message out to ensure that we reach the largest audience. Again, the second, education and training, ultimately being taught the correct way to do the types of things that you need to do in your job that could cause injuries and illnesses, but be aware, again, whether you're a new employee or just simply needing a reboot to know what's the safe way to do things. And then finally, the third is the consultation. So we have a great resource within the state of Indiana called InSafe. It's the OSHA consultation wing. And we have our folks in the safety and health area go out to facilities or hospitals or anywhere to be able to train or actually go and find the strengths and weaknesses within your safety program and actually walk the facility and go through those changes that you need to. And so we try to, both within the state, but also partner with hospital associations, primary care and long-term care, and other hospitals, starting with union hospitals, kind of jumping in the water, not just putting their toe in. That's, I think, really great to use them as an example. So I do want to at least bring up the CEO of Dr. Scott Tiefteller and have him talk a little bit about his success story and about the challenges and successes of putting safety and health within the healthcare system first and foremost in the culture. Dr. Tiefteller?
Good afternoon. It is a pleasure to have the opportunity to host this important event. And I thank the Indiana Department of Labor for recognizing Union Hospital as a leader in this initiative. Thank you, I'm going to continue this on. Thank you, Dr. Van Ness, and you as well, Commissioner Kiefer, for taking time in your busy schedules to be here this afternoon. Your presence signifies the importance of what we're trying to accomplish to make Indiana healthcare workers safe and healthy in their respective environments. Because of the results and the efforts of Union Hospital, I would like to personally call on all healthcare leaders across the state of Indiana to follow suit and make this initiative a priority in your organization. Because of our steps we've taken here at Union Hospital, we've been able to produce some significant results, decreasing our lifting injuries by 43%. Decreasing our falls by 38%, decreasing workers' compensation costs by 42%, and decreasing work time loss by 84%. As you have heard, when individuals are healthy in a work environment, we take better care of Hoosiers, and that's what it's about. Our focus here is to cultivate a culture of involvement and participation and to enhance employee safety. We address 3 areas, including the following: the environment, the person, and the behavior, with the primary goal focusing on employee safety, which ultimately produces the results I've previously discussed. Many actions were taken in order to achieve our outcomes, including providing continual education to leadership, staff regarding safe and best practices, empowering employees to develop solutions to safety concerns, the evaluation of behaviors to focus on lifting correctly, continuing cleaning up spills and reporting any safety hazards for repair. And also we conducted an initial and ongoing analysis of equipment, tools, and the environment with a focus on safety. These actions also include the provision of resources as appropriate, such as utilizing patient lifting devices to prevent employee injuries. In addition, we meet with employees who have reported injuries or near misses in order to prevent the same or similar event from happening to another employee. And at last, but certainly not least, the most important component of our program, which is to be fair and equitable and consistent with all employees in ensuring that everyone adheres to our safe practice policies. As a recipient of this Governor's Workplace Award, Safety Award for 2011, we have seen the benefits of developing a culture of safety through the reduction of workforce injuries and illness, improved conditions and increased employee morale. Working safely and health make good financial sense. And more importantly, protecting your employee is the right thing to do. I'm happy to commit Union Hospital as the first active party in this new initiative. And as I said, I would encourage all healthcare organizations to join us in this endeavor to make Hoosier country the absolute best for the people that we provide our care to. Thank you very much for being here today.
Thank you, Dr. Tiefteller. And again, I think to your comments, it's not a set it and forget it mentality with workplace safety. It's something that you have to spend many years and develop a culture to put that effort and have those conversations between the employee, and also it's one of the few things where it's a win-win. You have safe and healthy employees, and the money that you would spend on things like workers' comp can go back into the programs and into the folks and the training of those folks. And so we look forward, Union Hospital is the first out of the gate, first the post, and now we look forward to a call for other hospitals and healthcare entities to join this initiative, and really try to drive down those results and get us out of, sometimes it's not good to be second place, let's get further down the road. So now that we've talked about this, we want to give the opportunity for anyone here to ask any questions of myself or Dr. Van Ness or Dr. Teefe-Teller. If you prefer, we'd be more than happy to talk on an individual basis afterwards, but this is an opportunity to ask any questions that you have. Very good. Well, if there aren't any questions, that resolves that. Well, thank you again for coming out, and again, we'll be here for a few minutes afterwards. Be happy to talk, answer any questions. Thanks again for being here, and we look forward to great success in this initiative. Thank you. Just put this here. Tell me how you describe it here.
Once you stand behind it.
There we go. There you go. Now stay on this side as well.
Yeah, that's good.
They always say I'm different. Great.
We're just chit-chatting.